Back with Dr. Planty. Dr. Planty, an optometrist, but he also knows a lot about eye surgery and laser surgery. Is that correct, doctor?
That is correct.
Okay. So, Dr. Planty, tell me, what are some of the reasons and symptoms a person could have where he should be getting a surgery? And I also have heard that there are really a couple of different type of surgeries. Can you shed some light on it?
Well, there's no really medical diagnosis for having laser surgery done. I think that's more of a personal issue for people who cannot tolerate contact lenses in their eye, or don't have the dexterity to put contact lenses in their eye, don't like wearing glasses because their prescription is too heavy, hurts their ears, hurts their nose. There's a lot of different reasons individually why we want to have the laser surgery done. But laser surgery is an elective procedure, so it's not going to be covered by insurance, and you have to kind of figure out what you want to do to be able to go ahead and get the best results at that point. You are correct. There are several different laser procedures out there. Most of it right now is laser, which means they use the laser to make a flap. They lift the flap up off the eye. They use another laser to go ahead and sculpt the prescription into the cornea and then lay the flap back down. Then there's the other procedure that's called PRK, which is where they scrape off the top 5 or 6 layers of the cornea, run the laser, and then put a bandage contact lens on the eye and allow it to heal. Obviously, the PRK one, where you scrape the tissue off the eye, is much more painful, and the recovery is a lot longer. The advantage to the Lasik, where they make the flap, is that you heal quicker, and it's a lot more comfortable during the recovery time.
But does it do the same, the end result, like in terms of seeing better?
End result, you're both going to see better through both of the procedures. You're going to get there quicker with the Lasik as opposed to the PRK.
I see. Now, is there a difference in price for those two?
Yes, there is. When you use 2 lasers to cut on the eye, it's obviously going to be a little bit more expensive. When in the first procedure with the PRK, where you use just a little spatula to go ahead and scrape off the layers of the cornea, that's a very inexpensive procedure to do. So when you see a lot of these advertisings for Lasik, $299, it's more than likely going to be the PRK.
The scrapping one.
The scraping one, yes, sir.
And the one which takes longer to recover and is more uncomfortable.
Exactly, but it's cheaper.
I got it. Okay. And in the end, it does do the same.
And the vision is going to be the same. Either way you go. Exactly.
What about risk factor in either one of them?
There's always a risk factor, but if we do our preliminary examination correctly, there's several different diagnostic tests that we run to find out if a person is an ideal candidate. Taking topography of the cornea, taking an orb scan, which allows us to figure out how much distortion is in the cornea so that we can kind of predict the end results. Those are the 2 main tests that we kind of have to have results on in order to see how well you're going to be able to see coming out of the procedure.
I got it. And I'm glad you answered it that way, but my question was a little bit more what I meant. The scraping one versus the Lasik one, basically the uncomfortable one versus the more comfortable one, does one or the other one have a higher risk rate?
No.
No. Okay, good. Now, one thing I still don't get, and that is, so in terms of symptoms, who is a candidate for it? So, for instance, I told you already in another interview, I wear 99-cent reading glasses because when I need to be normally reading in normal rooms, I need them. Now, would a Lasik surgery be something which would help me, yes or no?
No.
No.
The Lasik procedure is pretty much for anybody who has a distance visual problem. If you have just a near visual problem, Lasik really isn't going to help that particular part of it out. But there are other procedures that you can run that will help just the reading part of that out.
Okay. I have no far vision problem. I can spot a pretty girl from very far away.
Hang on to that for as long as you can.
Yes. So, okay, good. So this wouldn't help me. So it's a far vision problem. let's keep digging a little bit more there. You know, we're having all those illnesses, glaucoma, does it help for any of those things? Tell me, rather than me rattling off all the illnesses.
The laser procedure, or the Lasik procedure, is strictly for a visual correction only, not for a medically induced condition. And there are several medically induced conditions that can happen in the cornea that would prevent you from having the Lasik. Number one would be keratoconus. We are always screening for keratoconus before we even attempt to do a Lasik procedure or a PRK on a patient.
Okay. Of course, I don't know what a keratoconus and a PRK is. Can you tell us in a layman's term a little bit, just a second?
Okay. Keratoconus is a disease condition of the cornea that essentially the cornea protrudes out it looks just like a cone. The cornea is starting to degenerate, and you don't want to do any kind of procedures on a degenerative type cornea.
Okay.
So we're looking for those conditions, and we run tests to make sure that condition is not in there before we do the laser procedure.
Got it. Okay. So basically, LASIK procedure is for people who overall, you know, when they drive, they have a problem seeing the sign all the way down the road, and they just, you know, maybe it gets a little blurry and stuff like that.
Exactly.
Okay. Good. Well, thanks a lot, Dr. Planty.
You're very welcome.